Welcome to the University of South Carolina College of Pharmacy Podcast, where we bring you insightful updates on happenings in the college with faculty, staff, students, and alumni, and share how the college is working to make an impact in the community. Joining us today is Reagan Barfield, a 2019 graduate of the college, who is now an assistant professor and director of the Tandem Health USC Pharmacy Residency Program. She also founded and directs the Southeastern Collaboration of Rural Health Research and Education Network, also known as SCORE, an initiative designed to provide collaboration for pharmacists, especially those practicing in rural areas, focused on improving care and promoting well-being in rural areas through pharmacy advancement, networking, collaboration, and much more. Reagan, thank you so much for being with us today.
Thank you for having me. I'm excited to be here today.
And we're excited to talk about the work that you're doing. But before we get into that discussion, tell us a little bit more about yourself, how you got into pharmacy as a career, and why USC.
Great question. So I am excited to get to tell you a little bit more about my background and my career. I knew that I wanted to go into pharmacy school when I was in high school. My aunt is actually a pharmacist, and she talked to me at length about the versatility of the field of pharmacy and how incredible it could be both to have a professional career that I loved, but also to be able to have a family too alongside of that. And so I was big into science and math, and it just seemed to all kind of add up that pharmacy would be the right move for me. So when I was applying to colleges, I was looking specifically at universities that had a college of pharmacy. Both my parents are graduates of the University of Georgia, so I knew I wanted to go SEC. I wanted big football, sorority, all of that, along with an incredible pharmacy program. So I looked extensively in the Southeast, and the University of South Carolina just always felt like home to me. It was incredible from my first tour as a high schooler all the way through my freshman orientation and then through pharmacy school. So I did 2 years of undergrad here and then 4 years of pharmacy school for the 6-year program. I received my BS in 2017 and then my doctorate of pharmacy in 2019. Was very involved during pharmacy school. I was actually president of 2 different organizations my P3 year. I don't think they let you do that anymore. I might have been the last one. Had an incredible pharmacy school career. Really, really loved it here. Made my best of friends, girls that were in my wedding and that I'm still super close with, and had some incredible mentors through the University of South Carolina College of Pharmacy. Through my experiences, I knew that I wanted to go into residency. I was hoping to pursue more hands-on patient care experiences, and so I ended up applying for ambulatory care pharmacy residencies during my P4 year. Ambulatory care pharmacy is a fun world. It's definitely a necessity in the world of pharmacy. I found that I would be able to have both relationships with the patients, but also with the providers. And that was something that was really appealing to me. So I was very excited to match with Prisma Health Richland for the ambulatory care program. My residency program director was Nicole Bookstaver, another incredible mentor of mine.
And an alum.
Yes, and an alum. So had an incredible year. Throughout my residency, I was also able to complete what's called a clinical teaching certificate program, and that is through the University of South Carolina College of Pharmacy. Through that, I found that I actually had a passion not only for patient care, but also for teaching and for academia. So we have 2 tracks in the CTC program. I now get to be part of the directors of that program in my role now as a professor, but through that, there's 2 tracks, one preceptor track and one academician track. So I was interested in academia, so I decided to go for the academician track and just fell in love with being able to mentor students, guide students, teach in the classroom. So I thought that my love of teaching would translate to teaching patients, but it actually has translated into now having a full-time role in academia and teaching students and pharmacy residents. So really excited to be able to complete that program even post-graduation.
What is it that excites you about being able to work with students and offer your guidance to them as they enter into their careers?
Great question. Part of it that has always excited me is there's a couple twofold. One, the moment when their eyes light up, when they truly understand a concept, is absolutely incredible. When you've talked to them about the pharmacotherapy or how to handle a difficult patient or a difficult situation, and they are able to then go and do it on their own, they have so much pride and joy in their work, and then they're motivated to continue helping others. I think the second fold of that is, if you can impact one student who then impacts hundreds of patients, you've had an impact on all of those patients as well. And so I just felt like my impact was going to be so much greater if I was able to mentor students and guide them and lead them. I was a coach, swim team coach, when I was in high school. And so I think some of those coaching skills have applied nicely to the way that I lead and the way that I mentor my students and my residents.
You also have a passion for rural health care. Talk about what sparked your interest in that and where you see that going as far as being able to provide care.
Absolutely. I had a strong interest in rural health starting in residency. Though I was in Columbia, South Carolina, not necessarily a rural area, it is very much a medically underserved area. The zip code 29203 is very poor, underserved patient population, and I got to take care of a lot of those patients, even working in a free medical clinic for one of my rotations during residency. And that really sparked my interest into this population that is vulnerable and needs medical services, and the pharmacist is on the front lines to be able to provide those services. When I stepped into my role post-residency graduation as academician and getting to direct this, or coordinate to begin with, and then direct the pharmacy residency program, I found that I was going to have a huge impact in rural through that. Tandem Health is a federally qualified health center located in Sumter, South Carolina, and they serve about 19,000 patients in Sumter County, most of which are considered medically underserved or in a rural county, living in a rural area. And so those patients are, again, they're very vulnerable, and pharmacists play a huge role in ensuring access to care, ensuring that they're receiving the best care possible, even in a setting that has limited resources.
Let's talk a little bit, and I mentioned this earlier in the podcast, SCORE, which is a program, an initiative that you actually founded. Talk about that, explain what it is, and the role that it plays in being able to help other pharmacists who are trying to care for patients in these underserved areas.
Certainly. So SCORE was developed really from a need that we found that pharmacists practicing in rural areas wanted a community. They wanted to have others that were practicing in rural areas that were facing the same challenges that they were, to collaborate with, to talk with, to work on difficult patient cases, difficult access issues. If we have a research topic that comes up, we can collaborate and do that research project together. So I found that there wasn't something similar in rural South Carolina, and decided it would be a good opportunity to create this organization. So we meet on the fourth Monday of every month. It's a dinner meeting, so 5 to 7. We provide a meal. We have some time for fellowship and to get to enjoy each other and build relationships with other pharmacists that are practicing in rural settings in South Carolina. Then we provide about an hour of education. So that could be education that is accredited, continuing education that is specific to taking care of rural patient populations, or we have a drug company come and provide updates and education, and then they actually sponsor our dinner meeting. So it's a pretty cool, unique opportunity for us to have time together to build those networks, have collaboration, do research, provide education, and then our trainees get to join in on that. So anytime there's students that are rotating at Tandem or Prisma Health out in Sumter, or we have our residents as well, they come and can sit in on those. We actually had students present at some of our SCORE meetings, and then those students are then further interested in rural. And I think that is the key, is ensuring that we continually have pharmacists and future pharmacists that are wanting to go into rural practice, since it is such a necessity.
One of the key words that I constantly hear come up in our conversation is collaboration. And I think that's one of the things I've heard so many people talk about recently, is the importance in the world of pharmacy of being able to collaborate, not only with other pharmacists, but with other healthcare providers. Tell us a little bit more about the significance of that and why it plays such an important role, especially in rural health.
Absolutely, yes. So interprofessional relationships are incredibly important to me, so much so I am married to a doctor. So we have interprofessional right in our home, but have always had a strong desire to ensure that we are collaborating not only amongst ourselves as pharmacists, but amongst the entire healthcare profession. So not just physicians, we're talking nurses and community health workers, our caseworkers. We actually have clinical pharmacy technicians now. That's a new initiative we've started at Tandem Health. So ensuring that we are all on the same page, that we're all collaborating together to better our care of our patients. In our Tandem Health residency program, we actually have physicians and PAs and nurse practitioners that serve as primary preceptors for our residents. They have the residents come on rotation with them for a month. They also participate as lead mentors in their research projects. So we have lots of interprofessional collaboration there with our upper level providers. We also have 12 family medicine medical residents at Tandem Health, and our pharmacy resident gets to collaborate right alongside of those family medicine residents. They share office space, they share patients, they share clinic time, they round together when they are rounding at Prisma Health to me. So we have lots of interprofessional as trainees as well, and we find that that is very valuable in ensuring that we are taking care of the patient as a whole and ensuring that they receive the best care possible holistically.
So with this collaboration, are you seeing firsthand that the outcomes are improving for your patients, that you're seeing greater success in their disease states?
Yes, 100%. We actually have data that shows this from research projects that have come right out of Tandem Health and from our residency program. So we've had patient satisfaction has increased, provider satisfaction has increased. We've seen disease state improvement, so A1Cs that are decreasing, blood pressures are decreasing, their hyperlipidemia or their LDL levels are decreasing. So all of those things are contributing to improved patient care and improved disease state management. And our pharmacists and physicians, nurses, our community health workers, all of them play a huge role in making that happen. We have a very, again, collaborative, being keyword here, group of individuals that work at Tandem Health. And it's been incredible to see. I think the patients truly appreciate that.
I'm going to jump back to the SCORE network just for a minute. Talk a little bit about the results that you've seen come out of that, how pharmacists have engaged with that, and the opportunities that they have to improve their practices.
Certainly. So one thing that has been interesting from the SCORE network is our pharmacists are actually able to present patient cases, and these are difficult patients that they have struggled with or that they just are stumped on how to actually treat. And so when we put our brains together and we all sit in a room and talk through these difficult patient cases, we've been able to come up with creative solutions for their disease state. So maybe it was a drug interaction and they just couldn't get them on therapy that they wanted to. Maybe it was an insurance issue or lack thereof. Maybe it was just multiple disease states and a heavy pill burden. Whatever it may be, we've had the ability to come together and really discuss, okay, what is going to be best for this patient? Can we prioritize their problems? Can we prioritize their health? How can we better care for this patient? And then our pharmacist is able to go back to their clinic, go back to those interprofessional relationships that they have, talk with the physician, talk with the nurses, talk with their physical therapist or whoever it may be, and really come up with a solution for that patient. So that's been incredible. We have pharmacists that practice in family medicine, in adult medicine, cardiology, in the retail space. And so we can all kind of put our heads together and figure out what may be best.
If someone wanted to know more about the SCORE network or to see how they can get involved, what would they need to do?
Absolutely. So we have a website. You can Google SCORE Network, Sumter, South Carolina, or Tandem Health. It should pop up right on Google. The webpage has information about our monthly meetings. You're also more than welcome to email me. I think my email will be available. It's reagankb@cop.sc.edu. You can Google me and find my email address. Happy to have others involved. We do have a virtual option. So if you're practicing in rural areas outside of Sumter County and want to travel to us, we'd love to have you and host you for dinner. But if that's not an option, we can provide a virtual link and you can join us alongside of that. And that is a quick email to me and we can get you all signed up.
I have one additional question for you. With everything you've experienced from being an undergrad to a Pharm.D graduate here, what does it mean to you to be a Gamecock pharmacist?
I love that question. So to me, to be a Gamecock pharmacist is a pharmacist that is on the cutting edge of the next generation of pharmacists, a pharmacist that loves to collaborate, a pharmacist that loves to lead others, a pharmacist that is continually learning. I think Gamecock pharmacists, we are one big happy family, and we love to take care of one another. And so just being part of that family, I have loved every minute of it and can't wait to continue and see what the future holds.
Thank you, Reagan. It's been a pleasure having you here on our podcast with us today, and we look forward to talking with you in the future as well.
Thank you, Margaret. It was a pleasure to be here.
Thank you for joining us for this edition of the USC College of Pharmacy podcast. You can catch up on past episodes or tune in next time and subscribe to our podcast on Spotify or iHeartRadio.